My name is David Erdman. I'm the owner of North Main Street Pharmacy in Cork, and we're part of the needle exchange program. Now, we've been doing the needle exchange since its inception in Cork, so that's roughly just over 12 months now. I suppose part of the reason I decided to go with the needle exchange was there was a few things. Part of it was we were having people coming in on a reasonably regular basis looking for needles and syringes. They were giving us reasons for it. A few of them were being honest about what they needed them for, but I didn't feel comfortable with supplying the needles and syringes without prescriptions at that time. So when the program came along, I already realised there was a demand out there. I suppose I didn't realise how big that was, but I certainly felt I could now help these people a little more. There's more I could do for them. So that's part of why we started doing it. So since we've started doing it, we've got busier with it. We find I suppose a few things come out of it. There's quite a few people are now presenting us with wounds, with injection site infections, with swellings, other symptoms likes of that. I suppose part of it is they're not always comfortable with going to their doctor and telling their doctor that they're injecting, or presenting to other people, because it's quite obvious for some of these wounds where they've come from. Yet some of them are so infected they really do need to be treated. So I've built a good relationship with the majority of my patients. We have a good bit of trust. I also have a nurse who I can refer them to, who will also be very discreet and make sure they get the right treatment. So if it's not something I can deal with in the pharmacy, there's somebody I can refer them on to. So again, I'll be shown a good few wounds. Some of them have been pretty horrendous. On a number of occasions we've sent people straight to hospital. I know we've saved a couple of legs and a couple of arms for people. We've had people who've been very, very near to blood poisoning. So it's been, I suppose, a positive for us to be able to make a real difference in that respect. And again, part of that's because of the trust we've built with people. So I suppose we would have clients with different needs and different ways we interact with them, and it's every interaction would be an individual interaction. I suppose quite often what would happen now, if we've had somebody on the program for a while, we've gone through many different bits and pieces with them. We've referred them on to Tier 3 services, for instance, and they don't really have any ongoing issues. They are now looking for a reasonably regular supply. So I could have people, especially if the pharmacy is busy, they'll come to the door, they'll catch my eye, and they'll literally hold up one finger, two fingers, and that's one bag or two bags. It's very, very discreet. It's put in a bag, and we've handed it out to them. Then we have other people who are looking for a lot more information, and I suppose in some ways I like those interactions too. I feel I can do more for the people because they're willing to open up. Now everybody's at a different stage, I suppose. Some people will start with not wanting to talk too much with me, and then as time goes on they will talk more and more, and then maybe they'll have a bit of a tough time and they want to talk a little bit less, and then they'll come back around and start talking again. But it's in those talkings that you start to understand some of the difficulties they're having, and you know, there's other help you can give. I can refer them on to other services, get them to talk to other people. You know, certainly our local addiction services, we've had a good few people have started on the methadone program and got completely off the injecting, but other people who haven't been, I suppose, what I'd call regular injectors. They've just been dabbling in it, and a good few weeks ago we had a good number of deaths in Cork from some bad heroin, which spooked a lot of people. So again, people wanted to talk to me a lot more, finding out what was going on, what they needed to be looking for, what they should be doing, and again that I suppose inspired a few people to go onto the methadone program. So we managed to help to get them to go onto that. So again, those will be the two, I suppose, main interactions. One is very little talking on most occasions, and then others would be a lot more. So with most of our people, what I do is I treat each month as a discrete month. Each month's a separate month for referring them on to other services, talking to them about immunisations and blood testing. So although I've said this to them again and again and again, sometimes all of a sudden, by saying it once and again, they'll say, yeah, actually maybe I do want that number now. And also that way I know that I've spoken to everybody about it. We've got a good few patients, so I don't always remember that I've seen them. And everybody's life is in a different place, and what wasn't right for them last month all of a sudden is right for them this month, and by offering it again, it can make a big difference with them going up. So I know before I did the training I had I suppose a few concerns about what were the patients going to be coming into the pharmacy like, what were they going to look like, how were they going to act when they got in here. I suppose after talking to one colleague, they said, are you going to have people crawling through the door with needles sticking out of their arms? And the reality is that just doesn't happen like that. The majority of the patients, you wouldn't realise that they were injecting drug users. We'd have a whole spectrum of people that come in. I have some professionals that come in suits. I have weekend users which would come in on a Friday, maybe on a Saturday. I have people that work in shops. Now we do also have people who would be living in sheltered accommodation or perhaps living on the street. But even them, they're very courteous, they're very polite, very knowledgeable, and there's never had any problem with any of them. I mean, I suppose people worry that injecting drug users might steal. I've never had any problem with anything like that. When they bring in their normal prescriptions, again, I've never had any problem with any of these people. And I find them a very knowledgeable group, and some of them very, very intelligent, and they probably know more about their drug use than I certainly do, that's for sure. But the key thing I find with the program, it's about reducing harm, but it's about reducing harm for the whole community. So that has two parts to it. It's about reducing harm to the individual injecting drug users, and it's also about reducing harm to the wider community to make sure that there aren't needles lying around the place or being left where they should be. But also by reducing harm to the individual injector, obviously then the community costs go down because there's less illnesses, less infections, and less long-term diseases to worry about.